Bride here. I am an ADHD, chronically ill clinical psychologist in California, and I spread awareness and information about all things having to do with mental health, including stress management, ADHD, and autism, and also living with multiple chronic illnesses. Today, I will share with you information about considerations for medication treatment for ADHD for both children and adults. If this is too long and you don't want to watch until the end, I recommend you logging into the Faces of Health app by yours truly. And on that app, there are several videos that feature Dr. Kerry-Ann Williams. She is a psychiatrist out of Boston who shares information on considerations and tips and other information that would be super helpful if you are considering starting medication treatment for managing ADHD features, either for yourself or for your child. But let's also talk about a recent study that was published in the British Medical Journal, or BMJ, just this past August of 2025. So many of the parents of my clients are hesitant to start their children on ADHD medications, and even adult clients may be hesitant themselves. I always try to share with them education about both the benefits and the risks or considerations with treating ADHD with medication. First, the best outcomes are typically seen when an individual combines medication treatment with behavioral therapy or executive functioning coaching. And there's been decades of research that show that combination of being most helpful for many individuals, not all. Keep in mind, each person is a case-by-case basis. So talk to your healthcare team and your prescriber about what will be best for you. But as I mentioned before, there was a recent article that gives additional information about the benefits and harm reducing positive impact of medication treatment for ADHD. So this study that was conducted in Sweden examined data from over 148,000 people ages 6 to 64 who were newly diagnosed with ADHD from the years of 2007 to 2020. The researchers wanted to see how medication affects not just the core features of ADHD, so hyperactivity, impulsivity, and attention, focus and concentration issues, but also how it can impact and benefit individuals in day-to-day life. What they found was pretty encouraging. Those who took ADHD medication had a 17% lower risk of suicidal behavior. They had a 15% decrease in substance misuse, so drug and alcohol use or misuse, and a 13% reduction in criminal activity, as well as a 12% reduction in transportation accidents, so speeding and resulting motor vehicle accidents. Most people were prescribed stimulant medication, which were associated with better outcomes as compared to non-stimulant medications. Even more significant for individuals who did have repeated difficulties, such as ongoing substance misuse or criminal behavior, the benefits of the medication were even stronger for them. In that group, medication was linked to a 25% reduction in drug misuse and criminal activity, a 16% drop in transportation accidents, and a 15% decrease in suicidal behaviors. This same group also saw a 4% reduction in accidental injuries. It is important to keep in mind that this same study had some limitations. First, the researchers didn't have information on medication adherence or exact dosages. So if someone took it consistently every morning or afternoon, or just took it a few times a week, didn't have that specific information. And they also couldn't account for whether individuals were engaged in behavioral therapy, coaching, and other lifestyle factors that can obviously influence those positive outcomes. But even with these limitations, the findings provide valuable insight. They highlight that medication treatment can do more than just help manage the features of ADHD themselves. It has the potential to reduce risks associated with ADHD features that can impact daily life and overall well-being, and helping in a way that produces very meaningful benefits. So if you or a loved one are considering taking medication for ADHD, it's absolutely natural and definitely supported to have questions and to ask those questions and make sure that those are answered before you start any treatment. Taking time to fully understand the potential benefits and risks of medication is key to making an informed decision that is going to be right for you or your child or your family. And so I hope that this video helped to provide some clarity, some additional education and information as you continue to explore your options. And as I mentioned in the beginning, please check out the videos that have been recorded by Dr. Kerry-Ann Williams, a phenomenal psychologist who is on the East Coast in the US, psychiatrist who's on the East Coast in the US, who talks more about questions to ask when you are meeting with a prescriber, when is a good time to start medication, and other considerations. Take good care.